Hello, thank you for joining our February Lunch and Learn during American Heart Month. Today we have Dr. Nicole Patching presenting on the topic.
So my name is Nicole Patching. I'm a family medicine physician here at Good Shepherd, and I was asked to do this talk on heart health. I do a lot of work with preventative health as a family medicine physician, so this topic is something I'm pretty familiar with. So, I guess it's okay to start with talking about the actual heart. So the heart itself is a muscular organ. It's located in our chest cavity between our lungs. It pumps blood through the body through blood vessels. It's a part of the circulatory or cardiovascular organ system. The blood that is being pumped carries oxygen and nutrients to our body, and then it also transports wastes like carbon dioxide back to the lungs. So overall, the heart plays a big part in being able to function as a whole. The heart itself has 4 chambers, 2 atria on top of the heart and 2 ventricles. And then it has 4 valves that function between the atria and the ventricles and at the exit of the ventricles. The heart is controlled by an electrical conduction system, and the electrical conduction coordinates contraction of the various chambers of the heart. So when a normal, healthy adult heart is beating, it usually beats 60 to 100 beats per minute, and this results in 5 to 6 liters of blood per minute being pumped through the body. So why talk about heart health, and why is it important? So February is American Heart Health Month, where an extra focus on heart health is made. Heart disease itself is the #1 cause of death in the United States. Heart disease is responsible for 1 in every 4 deaths each year, or around 1,800 deaths each day in the United States. Between healthcare services, medicines, lost productivity due to death, between the years 2017 and 2018, heart disease cost the U.S. $229 billion. So a lot of money going into this. Someone will have a myocardial infarction, also known as a heart attack, approximately every 40 seconds in the United States. So statistically, everybody knows somebody that's had a heart attack or will probably have a heart attack at some point in their life. So what is heart disease exactly? Heart disease itself is a broad term. It kind of refers to several different types of heart conditions. It's a form of cardiovascular disease. And so the different types of heart disease that can be included in these conditions are things like disease of the blood vessels of the heart. This is known as coronary artery disease, diseases of the heart muscle or cardiomyopathies, diseases of the heart valves or valvular disease, irregular heartbeats or arrhythmias, heart infections, and you can also see heart disease that people are born with, and this is defects called congenital heart defects. So who does heart disease affect? Heart disease is the #1 cause of death in both men and women, so affects both sexes. It can happen at any age, but our risk for heart disease increases as we age. The average age of the first heart attack in men is 65 years. In women, it's 72 years. And then heart disease is the leading cause of death for people of most racial and ethnic groups, including African Americans, American Indians, Alaska Natives, and white people. So what does heart disease feel like? What are the symptoms? Heart disease is often silent. Most people don't feel anything going on if they're having heart disease until they experience an event like a heart attack or heart failure or have an arrhythmia or irregular heartbeat. Some of these symptoms that can be felt in these certain situations, for a heart attack, you would feel things like chest pain or discomfort. You can have upper body discomfort, including in the upper back or the neck. Things like heartburn, indigestion, nausea, vomiting are also common things to experience in a heart attack. And then feeling extremely tired, dizzy, short of breath can also be experienced. When you have an irregular heart rhythm, you can feel racing or fluttering of the heart in the chest. This is called palpitations. You can also feel short of breath during these times. And then heart failure, you feel shortness of breath. You can get swelling in different areas of the body, like the feet, the legs, your stomach, and the neck, and you often feel very tired. So what are the risk factors for heart disease? So there's 3 key risk factors when we speak about heart disease, and around 47%, so around half of people in the United States, have at least one of these 3 risk factors for heart disease. So those 3 key factors are high blood pressure or hypertension, high cholesterol, and smoking. So what is high blood pressure? So blood pressure itself is the pressure of the blood on blood vessels called arteries. We also call high blood pressure hypertension. Between 2015 to 2018, over approximately half, 47% of US adults had high blood pressure. And symptoms of high blood pressure are usually silent. You can get things like headaches, sometimes visual defects, but most often you're not feeling anything at all. High blood pressure, high blood pressure reading is made up of 2 numbers, an upper number called a systolic pressure and a lower number called a diastolic pressure. And in looking at what is normal for these pressures, a normal category of systolic pressure is less than 120, and for diastolic, less than 80. The blood pressure starts to be considered elevated if it's between 120 to 129 for the systolic and less than 80 still for the diastolic. You go into stage 1 hypertension when your blood pressure is regularly sitting in the 130 to 139 systolic pressure or 80 to 89 diastolic pressure. Stage 2 is 140 or higher for systolic pressure and 90 or higher for diastolic pressure. And then a hypertensive crisis, which is something that needs urgent medical attention, is when your blood pressure is higher than 180 or higher than 180 for systolic pressure and or having a diastolic pressure of higher than 120. Then we have high cholesterol, also known as hyperlipidemia. So cholesterol itself is actually a substance that we need in the body. It's used to build cells, make vitamins, and other hormones in the body. Too much cholesterol, though, can be a bad thing. It forms thick, hard deposits on the inside of the arteries that can narrow the blood vessels. And over time, this narrowing can lead to something like a heart attack or stroke. The narrowing of the arteries itself is called atherosclerosis. That's a difficult word for me. Cholesterol levels, when we look at it as to what is good and what is bad, we look at different components of cholesterol. So it's composed of 2 lipoproteins and free fatty acids. So the 2 lipoproteins we pay most attention to are the low density lipoprotein, or LDL. And this is a type of what we consider bad cholesterol, where high levels are linked to increased hardening of the arteries, forming those narrowing hard plaques. And then high density lipoprotein, on the other hand, is a good cholesterol. It's protective against atherosclerosis, and low levels are associated with a higher risk of heart disease. Triglycerides are the free fats in the blood, and these in combination with low density lipoproteins or low high density lipoproteins also gives an increased risk of heart disease or atherosclerosis. The normal levels for a total cholesterol, we strive to have total cholesterol under 200 milligrams per deciliter. LDL, we want to be less than 100. HDL optimally is above 60 milligrams per deciliter, and triglycerides, we like that to be 150 milligrams per deciliter, and those are fasting levels. So smoking, tobacco use, this is the leading cause of preventable death and disability in the United States. It increases the risk of coronary artery disease or coronary heart disease by 2 to 4 times. It leads to disease and disability and harms nearly every organ in the body. As of 2019, around 14% of all adults in the US smoked cigarettes. And then each day, about 1,600 youth try their first cigarette. In 2019 as well, 36.5% of US high school students reported using any type of tobacco product. And this includes e-cigarettes, which have been shown to be just as harmful as smoking itself. In Oregon in specific, since we're here in Oregon, 5,500 adults die from smoking-related illnesses each year, and over 1.5 billion is spent on healthcare costs due to smoking-related illnesses in the state. Quitting smoking overall is one of the most important things that people can do to improve their health, regardless of age or how long they've smoked. So what are some other risk factors outside of the 3 key risk factors? Things like diabetes is shown to be a increased risk for heart disease. Diabetes is when our body isn't making enough insulin or not using your own insulin as well as it should. And insulin is used to help bring glucose or blood sugar into the body's cells for energy. A buildup of glucose when the insulin isn't working the way that it should leads to damage of several different areas of the body, including the heart, and that's why heart disease is part of that risk. Obesity is another risk factor, so excess body fat is linked to high cholesterol, high blood pressure, diabetes, and then things like poor nutrition, so diets high in bad fats, so saturated fats, trans fats, salt and sugar are linked to heart disease. Alcohol in excess is also linked to heart disease. Physical inactivity, being sedentary or not active enough, can lead to heart disease in the long term, and it increases the risk of things like obesity, high blood pressure, high cholesterol, and diabetes. Genetics is something that is an important factor to talk about when we talk about heart disease. Sometimes heart disease runs in families, so always letting your physician know if people in your family have heart disease is an important thing to remember. And then another one that's not commonly talked about is mental health. So it does show that over time, things like depression, anxiety, stress, and even post-traumatic stress syndrome can cause physiological changes on the body that increase the risk of heart disease. So what can we do to prevent heart disease? So preventing heart disease, we want to try and live a heart-healthy lifestyle. This is a way to keep your blood pressure, cholesterol, blood sugar levels normal and decrease your risk overall for developing heart disease. Leading a healthy lifestyle includes things like choosing healthy habits in your day-to-day life and taking charge of your health and medical conditions. So one healthy habit to look at is nutrition. In terms of nutrition, heart-healthy diets usually include high-fiber foods, vegetables, fruits, whole grains, beans, legumes, as well as heart-healthy fats, so things like olive oil, avocados, fish, flaxseed, nuts. These work together to prevent high cholesterol. Limiting salt in your diet is good to prevent high blood pressure and decrease the risk of heart disease. So the American Heart Association recommends no more than 2,300 milligrams of sodium per day. And ideally, if you already have heart disease, keeping that level below 1,500 milligrams. Heart disease or high blood pressure under 1,500 milligrams. And it's important to note right now, the average consumption in American diet usually leads to over 3,500 milligrams of sodium being consumed daily. So we're not really doing well as a society to help cut down those sodium levels. Limiting sugar in your diet is also a good way to prevent and help control diabetes. Sweetened beverages are usually the main culprit in added sugars in our diets. It's the most common source. In looking at added sugars altogether, the American Heart Association recommends no more than 36 grams or 9 teaspoons of sugar daily for men. To put that into perspective, 1 can of Coca-Cola or the same amount in apple juice is around 36 grams of sugar. And then that level recommendation for women is even less than that at 25 grams or 6 teaspoons of added sugar daily. Limiting alcohol is a good way to prevent high blood pressure and heart disease. When it comes to recommendations for amounts, we talk about drinks of liquor as the amount to control. So 1 drink is equal to 1 can of beer, 1 ounce of hard liquor, or 5 ounces of wine. Men should have no more than 2 drinks per day if they're drinking daily, or 14 drinks per week. Women, that's also lower, and the recommendation is no more than 1 drink per day if you're drinking daily, or 7 drinks per week. And then if you're not drinking daily, there's still the recommendation to not drink more than 2 to 3 beverages in one sitting. Another heart healthy habit is keeping a healthy weight. So the things that we look at in terms of weight, we usually turn to the body mass index, and this is your weight in kilograms divided by the square of your height in meters. Adult healthy weight is a body mass index of 18.5 to 24.9. 25 to 9.9 would be considered overweight, and obese is considered a BMI of 30 or above. And these levels are taken into account mostly for adults in terms of calculating childhood BMIs, because childhood obesity is something that is becoming more prevalent. It's calculated specific to gender and age. But in general, when children are checked out, we do strive to keep their ages 2 and above, we strive to keep their body mass index to the 85th percentile or lower for their sex or age to be considered at a healthy weight. Waist circumference is another way to assess risk for heart disease, and just as we know that increased abdominal fat is linked to heart disease. And so the general measures we look at is women with a waist circumference of 35 inches or above are at increased risk, and men with 40 inches or above are at increased risk. So another heart healthy habit is physical activity. Physical activity in itself can help maintain a healthy weight. It can lower blood pressure, lower cholesterol, lower blood sugars. In terms of how much is appropriate, the American Heart Association and the Surgeon General both recommend that 150 minutes per week, or 2 hours and 30 minutes of moderate intensity exercise is what adults should strive to get. Moderate intensity exercise can be considered things like brisk walking or bicycling. And then for children and adolescents, they should be getting at least 1 hour of physical activity every day. So outside of healthy habits, different ways that you can take control of your health. So making sure you're going and getting regular checkups with your primary care provider is important. If you don't have heart disease already, getting your cholesterol checked at least once every 5 years is recommended. more often if you do have heart disease or high cholesterol. And then getting your blood pressure checked at least once every 2 years if you've never had high blood pressure, more often if you do. Blood pressure is something that you can also monitor at home with an automated blood pressure cuff that can be bought in most stores. If you have diabetes or pre-diabetes, it's important to monitor your blood sugar levels closely. So talking with your primary care provider about treatment and monitoring options is always important. And then always take your medications as directed, and don't be afraid to ask questions if you don't understand something. It's important to be an advocate for your own health, and don't be afraid to step up if you don't understand.